CD19 CAR T-cells are revolutionizing the field to treat patients with relapsed or refractory B-cell malignancies. Yet the outcome are clearly still perfectible, and complete responses are not seen in all patients, and in a significant proportion of patients, these responses will not be durable. And if we look at our data using a defined composition, CD19 targeted CAR T-cells, there are about 25 to 30% of patients only that will remain progression or leukemia free in the long term. So still definitely room for improvement. One possible approach would be to infuse these patients with a second infusion of CAR T-cells, but there's very, very limited data to date. Is the approach feasible? Can we make a second CAR T-cell product? Is this safe? What is the toxicity profile? And is this just efficacious? We did this approach and we analyzed retrospectively 44 patients treated on a phase 1/2 clinical trial. And what we saw is that it was indeed feasible using our in-house manufacturing to make a second CAR T-cell product. In most patients, we had to use simply cryopreserved cells that were used for the first CAR T-cell infusion. So that was feasible in a vast majority of patients. In addition to that, we did not see a significant increase in the toxicities in cytokine release syndrome or immunologic toxicity. And this approach was safe in these patients. Although overall the response rates and progression-free survival was lower than it is seen in the CAR T-cell naive setting, we did observe durable responses in a subset of CLL and NHL patients after a second infusion of CAR T-cells. And importantly, we identified that 2 pre-treatment potentially actionable factors were strongly and independently associated with outcomes. The first factor was the type of lymphodepletion prior to the first infusion, and Cy/Flu lymphodepletion, cyclophosphamide and fludarabine, was associated with better outcomes. And the second factor was that giving a higher dose of CAR T-cells the second time was also associated with more robust in vivo CAR T-cell kinetics and superior anti-tumor efficacy. Having said that, we don't fully understand why we see lower efficacy after second infusion of CAR T-cells, and we have preliminary data suggesting that anti-CAR immune responses, in other words, immunogenicity, could be an important factor contributing to the impairment of the efficacy of CAR T-cells. But there's also other factors, obviously T-cell fitness or poor T-cell function in vivo, and other factors related to the tumor microenvironment itself. So there's a vast number of strategies to try to improve repeat infusion of CAR T-cells. One of them is to use a fully human CAR, and we have a clinical trial at our institution at the Hutch currently enrolling using CD19 CAR T-cells with a fully human scAV, and we are looking forward to look at the data and treat more patients.